So this is the video for vibrations, also known as VIBS, which is another manual technique. This is where the therapist would add a vibratory compression to expiration, following a deep inspiration by the patient, and this would be to generate turbulence through the expiratory flow. It also aids the expiratory flow and mobilises secretions, and this would normally be performed with the patient inside lying. It's differentiated from shakes, which is another manual technique, by the fact that you're applying a small amplitude oscillation throughout the exhalation, whereas shakes have a much larger oscillation, and this helps to move sputum in the small airways more distally. It can be used in patients with excess respiratory secretions with a poor cough, for example post-operative patients struggling with pain and the resulting pain increasing from a large increase in intrathoracic pressure when you cough, or patients with reduced lung volumes. It's often commonly used in children as well, as their chest wall is more compliant and this further aids movement of sputum. And you would use it in conjunction with the forced expiratory technique, also known as a huff and cough, to enable the patient to clear any respiratory secretions that are moved. Side effects that you should be aware of as a therapist are pain. This technique should not be painful for the patient, so if it is, you're doing it wrong, or the patient has a contraindication where you should not be applying this technique. Also, if you apply the vibration for too long of a period into the expiration and you're applying it too far down into the expiratory phase, then the compression that you're applying would reduce the lung volumes, and this would then start making airways meet in your closing volumes, and it would thereby be causing airway closure, and this is not what we want to cause with any of our respiratory techniques. Specific contraindications to using this treatment would be metastatic carcinoma, if the patient has had any chest wall trauma, and also cardiovascular instability, again because of the increase in intrathoracic pressure that you're causing. This can cause a reduction in blood pressure, thereby causing a reduction in preload, reduction in stroke volume, and then cardiac output, which is not good for patients with cardiovascular system problems. So here's a demonstration of a treatment for using VIBS on a patient. So you'd ask the patient to get into side lying, again moving their arm forwards out of the way so you've got access to the lateral chest wall. Again, you'd want to watch your hand placement, especially in female patients, just to make sure you're not putting your hands somewhere where the patient doesn't want you to, also where you don't want to be going. So you're going to almost butterfly your hands onto the lateral aspect of the patient's chest wall, making sure that your arms are pretty much straight and that you're maintaining good posture throughout, so it might mean lowering the bed. What the patient's going to do is they're going to take a nice deep, slow inspiration. On exhalation, you are going to apply a small vibratory force downwards into the bed, not pressing too hard, throughout their expiration, but stopping just before they stop breathing out, and the vibrations are going to help to mobilise sputum through the airways, because it's going to create turbulence and help them move centrally towards the main bronchus. Okay, so as we take a deep breath in and then breathe out. Okay, and then breath in and out. So what you'd do is you'd use this technique between 4 and 6 times. Then you'd ask the patient to use the forced expiratory technique, or if they needed to cough, you'd let them cough. And then you'd then check the saturations, maybe re-auscultate, depending on how effective that was. Ask the patient whether it was effective. You'd also be able to see whether it was effective as a treatment for that patient. And then that if it was an effective treatment or you wanted to repeat it, it could be repeated. The 4 to 6 VIBs could be repeated again 4 to 6 times.